the line and joining us by phone for the Caregiver Support Community webinar. Typically, we have about 200 or so folks that are invited to these meetings, and about 50 to 100 folks tend to join. These are recorded meetings, and they are archived on our GWAR website under the Family Caregiver Support page, and I think it's titled Wisconsin Caregiver Coordinator Community Support Meetings. So to get started, I will introduce myself. I will hand it over to Janet for advocacy updates, and I'm sure there is a lot. As I mentioned, Lynn Gall is out today, so I will provide quick updates with GWAR. And then I will turn it over to Kunal with Trualta. I will provide a few reminders along the way. No need to apologize. Just please, if you could, go ahead and mute yourself as you join, or if you get disconnected and need to rejoin. That way we just don't have any background noise. And following Kunal's presentation, we have Andrea Gar with the Dementia Care Specialist Program at DHS to provide us some updates on her work. So very quickly, I will just say that this is my second meeting. My name is Bryn Seaman. I'm the newest Older Americans Act consultant with GWAR, the Greater Wisconsin Agency on Aging Resources. And I act as the Family Caregiver Support Specialist. It's my pleasure to be here today and to meet with all of you, if not face-to-face, at least through a video format. And I will hold on to my updates and turn it over to Janet for her advocacy updates.
Good morning. Janet Zander, I'm the Advocacy and Public Policy Coordinator with the Greater Wisconsin Agency on Aging Resources. Thank you for a few minutes on your agenda this morning. The first thing that I want to bring to your attention is an advocacy action alert that I sent out this morning on Badger Aging List for those of you who are on the Aging Network listserv. If not, I will be including this action alert in a written update that I will send to Bryn, and she will share with all of you. The reason I want to bring it to your attention is because this advocacy alert is about current barriers to voting rights that are in place for the upcoming spring election on April 5th. We have a court ruling that says that people aren't able to get assistance returning their absentee ballots. And that assistance could mean taking it to the clerk's office, taking it down to the mailbox, which could be down a long driveway, across the street, at the post office, or dropping it in a drop box, even if it's one of those staffed drop boxes that's allowed. Most of them will not be. And it's obviously an issue that's really important to caregivers, because I've heard from many caregivers that they're helping people get the postage that they need, take it down to the mailbox. It's winter months, maybe drop it off at the clerk's office. This is a common practice for those of us who are caring for older relatives, relatives with chronic diseases or physical disabilities that can make it really hard to do that themselves, which is why in many cases they're voting absentee to begin with. So I want you to know that this ban is currently in place, and I want you to be sharing that with your caregivers so that they understand how important it is for them to lift up those stories to help people learn about folks that might have more difficulty returning their own ballot. We don't yet have a decision for what happens moving forward after the April election, and so their stories and the stories of the individuals that they're caring for are critically important. And so this action alert calls for letters to the editor. It calls for people to submit their stories to the Disability Vote Coalition, of which our agency is a member, and really helps to put a face on who might be impacted by this current court ruling and any decisions going forward. The second thing I'd like to talk with you all about is our upcoming Aging Advocacy Day on May 11th, 2022. May is Older Americans Month, as many of you know. The theme this year is Age My Way, and my way is often, in the community, staying connected with friends and family and our support networks. So Aging Advocacy Day is about building relationships with their policymakers, in particular their state elected officials, who are in positions to decide what budget priorities might be, what policies get passed around voting and caregiver supports and many other issues that are important to older adults and people with disabilities. This year, we will do a virtual training on Zoom on May 11th in the afternoon from 1 to 2:30. And then we are partnering with AARP to use their phone call-in system so that everyone can place 2 calls, one to their state representative and one to their state senator, to lift up those priorities around caregiving and voting. And we'll have 3 priorities that we'll be doing, and those will be shared as people get registered. We will be sharing more information. So registration is open now. I will have a link in the advocacy update for you to share with others in your organization and in your communities and in your caregiver support networks who might be interested in joining us. And it really is a great opportunity for us to lift up those priorities, as well as to learn how to communicate with our elected officials. Bryn and I were hoping to have an opportunity to share with you some information about a new grant, but we have yet to hear what our final news will be. So we're going to hold off on that for right now, but it will directly impact the work that you all do and how we're able to help with that. So stay tuned. The last thing I'd like to talk about is Older Americans Act funding. We finally have 2022 funding levels set. The federal fiscal year starts October 1st and runs through September 30th. So here we were at about the middle of February before they passed that budget and determined what funding levels would be for the year you're currently operating in with your National Family Caregiver Support Programs, for example. The funding, unfortunately, was well below what the president asked for and what the House and Senate asked for. So for whatever reasons, when the appropriators got together and put together this large, what they call an omnibus package of bills, funding was set incredibly low, 1.5% increases in some programs, flat level funding in others. And so we still have a lot of work to do, recognizing that needs have been very high, particularly as we're starting to come out of this COVID-19 pandemic, and the population is growing. So you're serving more people at higher costs with inflationary costs now, with less dollars to do that. And so work has already begun on the 2023 federal budget. The president just released his budget, which does include substantial increases for Older Americans Act programs. But as you all know, that's the beginning of the process. And we've got a long way to go to get that passed through Congress and back on the president's desk for signature. So as we just wrap up the 22 budget, we'll begin work on the 2023 budget. Any questions from me this morning? Well, I so appreciate your time, and I hope you have a great meeting.
Thank you so much, Janet. And please keep in mind that part of the reason I haven't muted us all upon entry to the meeting is because if you do want to express comments, feedback, or have questions, you're welcome to use the chat, and feel free to take yourself off of mute and participate that way as well. As I mentioned, following along the agenda, our updates next are with DHS and GWAR. Lynn is out, and I do not have any DHS updates that she provided to me. So what I can offer are my quick GWAR updates before passing it over to Kunal. I would just offer, and this is a little bit of an update also about Truralta, that I noticed that there was a support group facilitator training and tips offered on April 13th. It's 12 p.m. Central Time. So I did throw that in our GWAR newsletter, and I will continue to do so for those trainings as I'm made aware. If you haven't taken a peek at either the newsletter or that information about the upcoming training, please keep an eye out. In order to reduce the amount of email flow, I do add a lot into that newsletter with regard to caregiver programs. Another heads up is that our First Lady, the governor's wife, has offered to provide thank you cards to our caregivers throughout the state. And given that as a caregiver coordinator or program coordinator, you're likely going to know who those caregivers are, please let me know if that might be something you would want to share out with those folks who you think would appreciate it. I've had numbers ranging anywhere from about 5 and 10, 25 on all the way up to 100 or so, which is certainly acceptable. Go ahead and email me and I will put you on the spreadsheet. And that's all thanks actually to Kristen with our Dementia Care Program, the BOLD grant, who is able to offer some of those thank you cards. I was made aware while I was out last week that the survey I sent regarding the caregiver coordinator or program coordinator core competencies training areas has a glitch in it. So apparently there is a very small amount of text that allows you to enter information on the survey as to additional training areas you would find of interest. And I sincerely apologize. I hope to tackle that if I'm able to, yes, today or tomorrow, and get that resent out in an upcoming GWAR newsletter. The hope of that survey, and I'd encourage you to take it, it's less than 5 minutes, is to really identify if the core competency training work group is on the right page. In addition to AFCSP and NSCSP 101 trainings, which we hope to have available in the upcoming weeks on demand, there are also subject areas and categories that are of help to either onboarding new caregiver coordinator or program coordinator staff, as well as existing staff who just might want some brushing up or maybe haven't learned about that particular topic, and now is the time to delve into that. I have 2 more reminders and then I will be quiet and I will move on to Trualta's training and updates. I know that Jane Mahoney, my predecessor, provided monthly caregiver or family support type of newsletters. She is a fantastic writer, and although I like to think I'm okay, I don't know if I'm quite as stellar, and still trying to find my feet in my new role. So my way to help support you guys in making sure that you're able to have access to relevant information and maybe pull some of those articles for your aging unit or caregiver coalition or ADRC newsletter is to pull that all together with a variety of options for you to select from on a given month and decide what you would like to use and what makes the most sense for your newsletter in that month. So you can find that right on our GWAR website again, technical assistance and its caregiver support programs. There is a marketing tab, and underneath the marketing tab is where you'll find 2022 publications and links for that type of article and information. And another great place to help promote is on our Wisconsin Family Caregiver Supports Program Facebook page. Kim has been helping us out, and Lynn and I really do take a lot of time to make sure that we're providing relevant information. Most of it is for the caregiver population that we serve. Some of it might be more professional or family caregiver. And some of it is just public awareness information or age-friendly information or older adults or individuals with disabilities. So it does kind of span the gamut, but I think that if you don't already take a peek at it, it might be worth your time. And you can also reshare that information very quickly to your ADRC or Aging Unit Facebook pages. I see that there is a quick question. Yes, as far as the number of thank you cards, thank you, Terry, for asking. Go ahead and let me know the number of thank you cards that you would like from the First Lady. I will add that to my spreadsheet and I will get them mailed out directly to you as the professional staff so that you can disseminate them within your caregiver group. Might be a nice little addition to a caregiver gift basket, or maybe an offering at a memory cafe or powerful tools for caregivers. So thank you for asking. I don't see any other questions in the chat. I'll take just a brief few seconds for folks to unmute if they have questions or feedback. Okay, hearing none, I will hand it over to Kunal. Kunal and Laura Jane, thank you so much for joining us once again for our every other month meeting.
Thank you for having us. Good morning, everyone. My name is Kunal. I believe I've met a lot of you in person before, but virtually before, and it's great to see you all again. I have a very brief slide deck I'm going to use, but this is your meeting, so please do not let me invade it. If you want to ask a question, please interrupt me at any point of time. Last time when we spoke, we did a quick poll on what we want the next workshop to be. And the winner of that poll of the topic for today was what to do when a caregiver registers. And we're going to discuss exactly that. Before we get into it, I want to discuss some updates on the portal and just give you a heads up on what's to come. And then we're going to shift our focus to what to do when a caregiver registers. I'm always excited about these updates because every 2 months when we meet, it gives me a chance to show you guys everything that our product and content teams are working so diligently on. The first one is we have, as Bryn mentioned, we have a webinar on April 13th on support group facilitation guides. I'm positive that a lot of you are facilitating support groups of caregivers, and at times it can get onerous, it can get overwhelming. And we have an expert, Mary Lee, and she's going to be talking about facilitate on best practices of support group facilitation. She's going to have some tip sheets. She's going to have some checklists. So that will take all of the manual input and the repetitive work out of support group planning. And I believe it's going to be very helpful. There's also going to be a PDF with those checklists distributed at the end of the webinar. If you've not registered, personal recommendation to register and check it out. The second update is staff space is now easily accessible on your dashboard. Sorry about my mouse. When you log in, you'll see that you'll see a dashboard first thing, and on the same page, the staff space is right at the bottom. So on the staff space, you can go and you can find all of your marketing materials, training materials, and even our previous webinars. So a lot of times we had heard that staff members do not have the staff space link, and we just want to make it streamlined and easier for you to find it. And so here it is. The third one is the first lesson with Spanish translations is now live. I'm gonna ask for a quick show of hands. How many of you have caregivers whose first language is Spanish or who are more comfortable in reading stuff in Spanish? I see Margaret raising her hand and Terry, Alexa, Mary. Thank you. We have the first lesson. I'm gonna quickly show you what it looks like. It is a TIPA Snow lesson. TIPA Snow videos have typically been long. They have been about 2 to 3 hours long. Some of them have been maybe 30 to 60 minutes. But the good thing about these communication changes with TIPA Snow videos is they're very short. They're 3 to 4 minutes long. So essentially, you can call them like TikToks. They're as small as that. In these, TIPA Snow discusses how to get better at communicating with the care recipient, skills for better communication, responding to repetition, and impulsive and rude behaviors. You'll notice that there's an option for closed captioning for each of these videos. And this is the first lesson where we have added Spanish closed captions as well. We've heard loud and clear that caregivers would want and would appreciate Spanish. So this is our first foot in the door. We're gonna have a lot more Spanish content come on in the next couple of months, but I'm very happy that we've already begun. Next up, Wisconsin local resources are coming up very shortly. Bryn has shared with me a comprehensive list of local services, events, programs, supports offered to caregivers in your region and organized by the day of the week. And we're going to have that up on the portal in no time. If you want to add on or suggest any materials, please feel free to do that. I'll be happy to add them onto the portal. Sometimes right now is a time when there might be a little bit of lag with all of the new content coming on, but I promise you it's going to be on the portal. Any questions so far before I move on? I see none. I want to discuss the last segment of the updates, which is interactive e-learning content. We have heard that caregivers come from diverse care situations. They come online with specific problems or situations in mind. And it is most helpful if we provide to them a scannable layout to quickly navigate to the topic that they're most interested in. Basically, learning activities that address specific problems or situations. Custom micro-learning videos, printable tip sheets, and interactive problem-solving scenarios. We are going to call them toolkits on the portal. A toolkit is essentially a term for easily navigate content that's very easy to navigate. For example, let's talk about personal care. If there's a caregiver who is trying to get information about personal care, we want to provide them with the most targeted information when they need it. So on the personal care toolkit, there'll be 3 tabs on the highest level: toileting, bathing, oral care, as an example. And then within toileting, there's going to be a tip sheet, toileting the basics. There's going to be a Teep Us Know video. What are the right cues someone should use for toileting? And then individual common situation elements, like what are some poor hand washing or wiping techniques and how you can improve them. How would you change your loved one when they're in bed and they cannot really get up? How are you going to change a pull-up without removing pants and shoes? So basically really, really niche situations, which are not really uncommon for caregivers. Caregivers go through these on a day-to-day basis, and giving them such targeted help is exactly what they would benefit from. So we are going to have about 10 to 11 of these toolkits go live in this year. And each of those toolkits will also have English and Spanish content. So we're trying to reach as many caregivers as possible. Just as an example, we had a lesson go live on the portal, which is a very interactive lesson. It's called Try It Out Repetitive Communication. And I want to quickly show that to you. It deals with the very common situation. The loved one or the care recipient is really talking about the same thing over and over and over again. And it is easy for caregivers to get frustrated. And how do they deal with that in that moment? Have you guys had a situation where internet does not work as fast as you'd like it to, especially at the time when you'd like it to? Because it's happening to me right now. This will have this content has scenario-based lessons on the portal right now. Let's go ahead with Barb tells a favorite story. When the caregiver selects it, she is given this scenario. Barb is telling about the story when she and her brother worked at the same store together. And it's very common because caregivers want to reminisce about the happy times in their lives, about the memories that they still have. And based on this, the caregiver will have these choices. They would select a response to continue the scenario. Now they can, let's say they sit close and listen while Barb continues telling the story about her and her brother, and it will give them insight on how that would work out. So Barb would tell the story again, but it would frustrate the caregiver. So this one affected them. So they can review other choices and they can go ahead and pick another option. Like get a photo album from the shelf and ask Barb to tell you about one of the pictures, and that is gonna end super well for both of them. Barb gets a little distracted, the caregiver is able to get up and focus on something else, and both of them are relaxed. So this is just an example of the interactive content that we are going to have live in the next couple months, and I believe that it's going to help. I'm going to pause here for any questions you guys might have.
We got a little feedback in the chat. Terry said that this is very cool. If anybody else has any feedback or comments, also feel free to use the chat. I'll be monitoring that and sharing with Kunal.
I walked through a couple of scenarios myself, and what was nice is that you can also select the wrong choice, and that shows you how that scenario also plays out. So it's not just all about getting it correct and hoping that you're kind of quizzed and you answer correctly and the situation is resolved. It's truly a technique of learning that teaches you the different outcomes based on your reaction. So I found that to be helpful. And then one other last comment that I would add is I'm just newly getting used to Trualta myself as a new learner, is most of the information can be read out loud. So if you're somebody who enjoys podcasts or even webinars, you're listening to that, and we're all busy as our caregivers, endlessly busy. You're typically doing something else, maybe working on emails, or maybe you're, as a caregiver doing laundry or making a meal for your loved one. These are really quick hits on a phone where you can listen to information as you're doing something else. So I would just offer that as a convenient feature.
Absolutely. One of the main things that I've heard on caregiver interviews is if they're working even part-time and they're taking care of someone else, it's very important that they're able to balance the two, because caregiving is a full-time job in and of itself. So having these audio voiceovers really helps them just do things simultaneously and get value while they're doing something else as well.
And we're getting positive feedback in the chat. Everyone's enjoying the changes, and they think that having the different scenarios will be helpful for the caregivers to see the different choices played out.
Thank you. I'm very happy to read the comments. I really appreciate your feedback. One thing that I've been thinking and I've been wanting to do for a while is including your voice on these meetings and your feedback and your experience. I'm proud to have been working with Margaret over the last couple weeks. I met Margaret in the beginning of January, and Margaret said her goal was to add 10 caregivers on Trualta, and I'm not going to give away the magic number just yet, and I'm going to turn it over to Margaret to share her experience with the whole portal and how it went.
Thank you, Kunal. Good morning, everybody. Trualta has it just keeps getting better, and I can't wait to share these new things with our caregivers. And I believe going with Spanish and with some of the modules is going to open up for a whole new community with our caregivers. We started out when I took over this position in Kenosha County. It seemed to be a lot of work for one person, so nobody really had committed to it. So when I came on, I made that my goal. I know Kunal didn't want to say my numbers. My personal goal for the year was 10. I'm at 35 right now since January. So thank you. And I found a structure of how I get those people and what I do once I do get them to sign up. Because as I've told Kunal, just getting the numbers doesn't mean anything if the caregivers are not using TrueAlta. So I want them to know the new things that are coming on. So some best practices that I've found is I send out, when I get a request for information from our ADRC about caregiving, I send out an email describing TrueAlta with the tidbits that come in Stab Space, and I wait for them to say yes, please register me. I then sign them up on TrueAlta. I email them a second time and let them know that I have done this, and if they do not get this invitation link from TrueAlta, to go ahead and check their spam folder, because if I don't do it right away, I'm going to forget, and then they might not ever sign up. Once a week, usually on Monday, before everything blows up on a Monday, I go on my TrueAlta and I see how often people, has anybody been on in the week prior? If they haven't been on, then I think of specific things that might be interesting to them. And I send that email. I notice you haven't been on. You know, I'm recommending some things. You'll get an email for those. If there's anything else, please let me know. You know, and I tried to build that relationship with my caregivers as well. I've gotten amazing feedback. This morning, I got one from a gentleman who just signed up on our website yesterday for it, and I got him registered right away. And he said that his first module on dementia sounded so familiar to him. It was so helpful. It was like it was written directly for him. And so and plenty of just thank you for registering me. Thank you for introducing me to TrueAlta. So that's very exciting.
I'm very happy to hear all of your enthusiasm, honestly, Margaret. Do you also want to talk about how do you spread the word about TrueAlta? Caregiver education can be met with a lot of resistance. A lot of caregivers might say we don't have the time for it. How do you spread the word about it?
Okay. Well, first of all, my position is located in the Aging and Disabilities Resource Center of Kenosha County. So we had an all-staff meeting, and about a week before that, I sent out an email to my peers of what TrueAlta was and how I envisioned building it in Kenosha County. I included an email that they can use when somebody comes in and asks for anything in the ADRC. It's in their packet now. It's an email with my information. For more information, you know, reach out to me. Also, in on our ADRC website, we have a big red button that says click for more information, and that's under our TruAlta information. So that's a great one. We took part of an expo for Kenosha County where the ADRC had a booth, and we had TruAlta flyers that we have made our own under the Canva. I've also presented at different caregiver groups. May 9th, I guess I'm presenting at the Kenosha County Commission on Aging. So that's exciting. Let's see. We have a Kenosha Caregiver Coalition that has other professionals and caregivers on it. So I've spoken with them, and I just made some postcards up to distribute with our Meals on Wheels through a different organization. So this afternoon, I'm going to run 250 postcards. Again, that's available in staff space, and you just put your registration information. It's so easy to do this, and just get them out there. So that's it. Oh, you're muted, Kimo. Yeah, thank you.
Of course I am. No wonder I am. Happens to me once every meeting. Anyway, I'm so glad you're using the materials in the staff space. I know I've been spending a couple hours every month on the staff space. I'm very happy to see you guys are using it. You're getting a lot of applause from your peers in the chat box. Terry asked if you're willing to share the email you sent to your peers introducing TruAlta.
Sure.
Bryn, can you make the connection?
You bet, Margaret. I'll follow up with you, and if you want to give it to me, I can include it in the notes from today's meeting.
Sure, and I believe that email was also something that came from TruAlta that we just changed with our information. So like I said, if you look at the staff space, it really helps you. Oh, one other idea that we're working on is putting TruAlta information at different skilled nursing facilities, adult family homes, anywhere there may be a caregiver involved. Some physicians' offices, just trying to really get that word out.
Absolutely. I heard this from someone else. Clinician offices and healthcare provider clinics where families might receive the diagnosis of dementia, or where they go for checkups when there's a new symptom. Those are particularly times when caregivers can get overwhelmed. Those are times when they need support the most, and that is probably when they need these resources the most. So it's a great idea to have even postcards distributed to these clinician offices. I think that's a great idea. I'm gonna share my screen once again, but I have nothing on the screen that Margaret has not already covered. What to do when a caregiver registers. The first one is trying to check in with the caregiver and understanding exactly what their care situation is. Everyone has different motivations. Everyone has different reasons why they want to get education, and finding out their why is the first and the most important step to getting to know the caregiver and getting them engaged. The second one is showing them around the portal. Now, if you have the time, if you have 15 minutes to spend with the caregiver, you can go ahead and share a screen and show them, oh, this is where you click this is where you click that, A, B, and C, and this is how you get value. If you don't have the time, it's totally understandable. You guys are juggling a million balls in the air at once. you can just ask them to click on the information video on the portal, because that is also going to give them a very good gist and a very good idea of what they can get out of the portal. If you see on the cover page, there is a 1-minute video, and then when they log in, that video still stays on the bottom right corner. Okay, that's an internet problem. Okay, so there is a 1-minute video right here. Caregivers can just look at the 1-minute video, and they can still get a good idea on like an onboarding to the portal. And then the third one is recommending content to the caregivers. That is very closely tied into number one. When you know more about their care situation, you know that they're facing with these problems, and you can recommend targeted content to them. If a caregiver's loved one is now getting agitated and anxious, you can recommend agitation and anxiety to them. You can also go ahead and recommend some other content which will help them take care of themselves, because if someone is getting agitated with me, I'm sure gonna need some taking care of myself. So when you know more about the caregiver's care situation, try and recommend content to them. Again, if you don't, if the caregiver registers and you don't have the time to chat with them for a couple days or maybe weeks, that is fine as well. Because when the caregiver registers, they go through onboarding questions to ask them about their unique care situation, what is the purpose, what their focus is, how much experience they have. And based on that, the system recommends custom content or a custom course to them as well. If you do have a chance, do recommend content to them. We've seen that it works wonders. I'm going to pause again. Does anyone want to add on something to this? Because I know a lot of you have been really active with the portal, and I want to see if you want to add on something to this list.
We have about 16 minutes left in the meeting, and I know you want to get a direction about where to go for our next meeting. Would you be able to ask and solicit some information on that, and then we can leave the last 15 minutes or so to Andrea?
Was that for me, Bryn?
Yes.
Okay, sorry. Sorry, I spaced out for a second there.
No worries.
For the next meeting, I again want to ask for your opinion on what the next topic should be. Laura Jane is going to drop the link in the chat box, and a few options here are motivators and barriers for caregiver education. What really works with caregivers, what doesn't. Second, a content overview. And the third one is how to personalize caregivers' learning journey. And 100% we'll be taking your opinions into account, and that will be the next topic. So I'm gonna leave this link with you. Andrea can begin the presentation. I will take into account the results of the poll, and that would be the topic of the next meeting. I don't want to chip away any more time.
Thank you so much, Kunal. I appreciate it.
Thank you. Thank you all for joining. Andrea, the floor is all yours.
Good morning, everyone. My name is Andrea Gar. Many of you already know me, but a little bit about myself. I am the current program manager for the Dementia Care Specialist Program, which is in the process currently of going statewide. I have been in this role for a full year as of yesterday. And what an eventful year it has been. So stepping into the role at the end of March last year, and then just 3 months later, the governor signed the biennium budget that allowed for our program to go statewide, which is something that we had been advocating for many years. So, you know, when I say it's been a wild ride, the last year has almost felt like a rider that mounts a horse, and then the horse just kind of takes off. So most of the year I've been just, you know, holding on to the reins while I both learn the particulars of this new role, as well as contribute to conversations about what the expansion of the Dementia Care Specialist Program should look like. So I'm really, really happy to be here with all of you today. One of the things that's very important to me in this role, and to Jane Mahoney before she left, Lynn Gall, and to Bryn, is to foster a greater level of collaboration between the Dementia Care Specialist Program and the caregiver coordinators, especially now with the expansion. And one of the things, and I'll get into some details about the expansion in a moment, but one of the things that expansion has brought is the opportunity for some of our dementia care specialists to actually share their position with the caregiver coordinator role in order to make their position whole. So certainly this calls for a lot of new and exciting opportunities for both programs. And so again, I'm just delighted to be here. A little bit about myself. I was once a dementia care specialist myself. I was a DCS in Milwaukee County from 2015 to 2019. Prior to that, I was a diagnostic screener within one of the WAI affiliated memory clinics at an agency called United Community Center on the south side of Milwaukee. So they are the only affiliated clinic that provides full memory services in Spanish without the aid of interpretation. So a little bit about the DCS program. And I know that there are some DCS on the call, but the DCS program was really built around 3 major pillars. The first is to create dementia-capable organizations, beginning with the ADRC that employs them. Most of our DCS that are not a tribal DCS are actually housed within an aging and disability resource center. So their first responsibility is really to work within their own organization from the top down or from the bottom up to make sure that everyone that works for that organization has at least a working knowledge about what dementia is and what it is not, how it presents, which of course means common symptoms, and to provide an understanding about the available resources in the community where they work, so that families who reach out to the ADRC and are experiencing, you know, a family member that is living with dementia, that person can receive the quality of care that they need to receive from that ADRC. One of the second and very important pillars of the DCS program is to create dementia-friendly communities. And this pillar creates some level of collaboration with most of our caregiver coordinators, but basically what that means is working with coalitions and other community champions to make sure that the community has the information and the tools that they need to appropriately respond to community members that are living with dementia. The goal of the program, of course, is to provide the care and the support that a person living with dementia and their family caregivers need so that the person living with dementia can safely remain in the community for as long as possible. And certainly not within our circles, but for a lot of people, when you think about people living with dementia, people tend to get this mental picture that people living with dementia live in nursing homes or assisted living facilities. And unfortunately, even now, the majority of the funding, the supports and services tend to be pushed or geared toward people in the later stages of the disease that may be, in fact, living in a healthcare facility. But you and I know that the majority of the people living with dementia do not live in a healthcare facility. They live at home. They're still in the community. Yet there was, until the DCS program, and even before that, before the AFCSP program in Wisconsin, there was a limited level of supports and services that was directed at individuals who were at that early stage of the disease progression. So both your program as well as ours was really created to fill that gap and meet that need for people who are still living in the community, which is where they will spend the majority, and in some cases even all, of their journey with dementia. The final pillar of the DCS program, and the area where a DCS is likely to have the greatest level of collaboration with a caregiver coordinator, is serving caregivers and individuals that are living with dementia. So that means direct care consultations, resource referrals, the provision of an evidence-based intervention or an evidence-informed intervention that is directed either to the person living with dementia and or their caregiver, and each DCS or each community is required to provide two interventions, one directed towards the person living with the disease and the other to the caregiver. With expansion, we have a considerable number of new DCS right now. I think since January 1, which is when our expansion launched, we have added about 25 DCS to our ranks. The majority of them are full-time DCS, but a good number of them are part-time DCS. And part-time DCS, as I mentioned, might be split with an additional role within the ADRC, most typically caregiver coordinator, or a what's called an ADRS, an Aging and Disability Resource Specialist, formerly known as INA. Those are the two most common position splits. But they are working with families to provide that support, to provide care consultations, to provide both short-term and long-term care planning, which is very important, and also to facilitate community resources like support groups, memory cafes, book clubs, and other kinds of respite and or support activities in the community. So as I mentioned, we are very interested in facilitating a greater level of support. I know that the level of collaboration between a caregiver coordinator and a DCS across the state varies widely. When I was a DCS in Milwaukee, my colleague and I worked very closely with the caregiver coordinators in Milwaukee County. But I have heard since I've been in this role that that's not necessarily the case everywhere. So just want to encourage that there is an open line of communication as well as referral back and forth between caregiver coordinators and dementia care specialists to the support and benefit of our families in this state that are impacted by Alzheimer's and related dementia. The dementia care specialists also meet in a situation similar to this. We meet twice monthly for training and peer support. So to that end, Kunal, I'm not sure if you are still on the call, but I would definitely love to get your contact information. I recently had a Trualta demo myself that was provided by Lynn Gall and came to understand the rich resources that are available through that program. So would be interested in inviting you to attend one of our meetings and present as well. We've got about 3 minutes left. Are there any questions? Very good. Thank you very much for the opportunity to join you guys this morning. I will throw my email address in the chat in case you would like to reach out to me with any questions that come to mind after the conclusion of today's meeting. But thank you for the opportunity.
Thank you, Andrea, for joining. And to that end, if there are dementia care specialists who don't have this information, or maybe they don't work in a dual role and so they don't have necessarily the Outlook invite, or maybe aren't receiving the GWAR newsletter with the information, please, as caregiver coordinator, other program coordinator staff, share that with your DCS. I do think it's a vital collaboration. Moreover, and this will probably be another speaker another time down the road, but also your kinship coordinator. So caregivers come in so many different roles, and sometimes acting as both caregiver to husband, spouse, in-law with dementia, as well as, you know, a relative acting as or in the role of primary caregiver as parent. So just keep those situations in mind. There's usually a lot of good synergy that can happen between your knowledge and power and your funding, along with DCSs and kinship coordinators.
And if I may take just a second to address a question that came in the chat about where the DCS can be found. There is a map on the DHS website, but basically apart from tribal DCS, the DCS is always going to be housed within the local Aging and Disability Resource Center. So in most cases, if you have a family or a caregiver that you would like to refer to a DCS, you can simply refer them to your local ADRC, and then they can facilitate the referral to the DCS. In some cases, the referral can be made directly to the DCS, but I would say visit the website for your local ADRC. If you are providing services to a tribal member, then the tribal DCS is either going to be housed within the aging unit, the tribal aging unit, or the tribal health center.
Thank you, Andrea, for catching that question in the chat. I'll give it just about 10 more seconds so that if there's others they can ask. Okay, our next meeting will be Tuesday, May 24th from 10 to 11 a.m. We'll be hearing advocacy updates, DHS and GWAR updates, along with some Trualta updates. And at the end, our guest speaker will be Rachel Brightman and Deanna Schuett, I believe is how you pronounce her last name, with United Way 211, specifically their offer and supportive listening with caregivers, and that service that they offer free of charge. Hope you all have a wonderful rest of your week, and thank you so much for joining today. I appreciate your time. Bye-bye.